Where's the macula and where is the vision on the macula?
Okay, great idea, great question. So the retina, like we already mentioned, that's the inside lining of the back of the eye. That's what light gets focused onto. The macula is like the bullseye for the retina. About 90% of our vision actually takes place in the macula.
What happens with macular degeneration? And there's a wet and a dry. Which one is common, and what can you do for which one?
Yes. So with macular degeneration, and the reason it's age-related, it's almost like the retina just starts to wear out. Okay? And so there's two forms, like you mentioned. There's dry and there's wet. Wet refers to there being blood or fluid underneath the retina. Right now, there's really no good treatments for the dry. But generally speaking, the dry form is not nearly as bad as the wet for most people. That's not always true, but for most people, the dry isn't nearly as bad.
Why does the dry go to wet? What happens?
So, well, what happens is it starts to get new little blood vessels that grow underneath the retina. And so for the dry part, the only recommendation that we have right now are to use some vitamins. And so there's a lot of different vitamins that are made for dry macular degeneration. The wet form, back 20 years ago, was basically a death sentence for the vision.
Yeah.
There was very little you could do. There were laser treatments, but none of those laser treatments usually resulted in good vision. So nowadays, there's injections. So a lot of your viewers might know of people or hear of people getting injections in their eye. Most of those injections are for macular degeneration. There's a few other things that injections are good for as well, but macular degeneration would probably be by far the most common thing.
I've talked with people that have had injections into the eye, and I said, wow, doesn't that hurt? And they said, no, the way the treatment goes, you inject medicine into the eye that makes those blood vessels not form again behind the retina. That must be amazing to see also.
Yes, well, and it sounds awful, right? Getting a needle in your eye, but for most folks, do just fine with it. And what it comes down to, it actually, for most people, it's a very easy decision. If your option is go blind or get injections in your eye, guess what you choose? You choose the injections, and it's really not that bad.
So is the eye sensitive on the outside of the eye that's injected? Do you have to put numbing medicine there before you stick the needle in?
They put a little bit of numbing medicine in there, but it's a very small needle. And again, it sounds terrible and it would sound something very scary, but it's really truly the difference between, for a lot of people, keeping the vision or not.